welcome back to the party, baby. We are on season 2, episode 3. And
Opria's Open Mic with your favorite Sean and Aaron.
There you go. Guess what? I have a super special guest today. This is Dr. Ethan Kellum. He is incredible. Okay, so he was my stem cell doctor, but besides that, so he's like regenerative orthopedic doctor. Right. But he has an amazing career. So he also works with the Titans. He does a lot of the stem cell for the Titans, which is the NFL team. On top of that, he works with some of the Olympic basketball. I mean, he has a resume like you guys wouldn't believe. But
basically, one man in a long list of men that Aaron goes to outside of me. And she's like, I'm going to go see Ethan. Okay, like, I'm going to go see Kenny. Okay. I keep hearing about these guys that you visit and apparently come back healthier. And so I want to know what's really going on.
No, but Ethan, so this is Dr. Kellum. Thank you so much for coming on.
Thanks for having me.
You're freaking amazing. You changed my life when I came for stem cells. That's how we met. I was referred to you when I had the heel pad separation and did stem cells, and it worked, and it was amazing. But today...
And I was there. We're going to come back to that because I got to watch that happen. You have no empathy for pain, apparently. You're like, do you need a wooden stick to grit down on?
No, I feel it. I do. I feel it. But you just got to press.
You got to go, baby.
No, you were nice and smooth and made it happen. And holy cow, that it did wonders.
It did. So not only did I do stem cells with you, Hayden did them for his hamstring. But we're going to do a whole podcast one day diving into that. But today we're going to talk on it because you still do the orthopedic, a lot of the alternative stuff with orthopedic stuff. Mm-hmm. That's like your main thing. But
you're an orthopedic doctor.
Yeah.
Yes.
I'm an orthopedic surgeon.
Orthopedic surgeon.
I apologize.
Yeah.
But you do both, the orthopedic surgeon as well as the stem cell, the PRP, all that kind of stuff.
Correct, yeah.
But you're also diving into more anti-aging as well as like sick care versus true health care.
Right, yeah.
What does that's what I want to talk about today, because the power of preventing as opposed to fighting is amazing. And can you dive into what are those words to you?
Yeah, so it kind of started, it started back in medical school for me. So there was one day when the professor said, the half-life of your medical school education is 3.5 years. And I go, so you mean before I leave, like half of it's obsolete? And they were like, yes.
Oh, no.
But I didn't know exactly what that meant.
Yeah.
And so as you get out and you go and you start to treat people, and especially as I move more from surgery now to the alternative things and trying to keep people out of the OR, you start to realize that, man, we can prevent some of these things.
I love that. Keep people out of the OR.
Keep them out of the OR. But it has to do with things that aren't that sexy, right? Nutrition, getting rid of toxins.
Nutrition isn't sexy?
No, it's not.
I think nutrition's
sexy. In the 4x4 diet author right here.
It's sexy in that way, but not the way that we, as Americans, we typically
Because we like quick fixes, and it's not an instant thing.
For sure,
and nutrition is definitely a slow, steady. It's not something you eat a salad and tomorrow you're healthy. It's something that actually takes time. And you have to be continuous, and you got to be repetitive.
The kind of grind that isn't sexy.
And it can be boring, as people say.
100% boring.
But why is healthy boring?
Healthcare, because once again, it's not sexy. It doesn't fire off the dopamine.
Oh, yeah.
We're looking for the quick fixes, things that just aren't going to get us where we want to go. And so as a country, we're 5% of the world's population. But we use 80% of the pharmaceuticals out there, 75% of the pain medications out there.
That's insane.
Because we've done it the wrong way. We think, we'll live forever and we can just do this, and then they can fix it on the back end. When we really need to fix things on the front end, right, and do a better job of that. But that's not we don't have true health care. We have sick care. Everything they taught me in medical school was about this disease, this disease, and this is what you're going to do for this disease.
But they didn't talk about how do you prevent these diseases from coming in here?
They didn't teach me how to prevent those diseases. And
Did they even talk about nutrition?
Great question. I'm first year of medical school. Gross anatomy was worth 25 credit hours. That one class.
That's a ton.
That's gross anatomy. We had a nutrition class. Guess how many hours that was worth?
4.
2. What the fuck? And not only that, they were teaching us stuff from 1940s. Here's healthy. Glass of milk, piece of bread, 2 vegetables, and a meat, whatever.
Oh, wow, that's crazy.
So
yeah, it's evolved.
Yeah, it's evolved. Some of us have evolved, but healthcare, I bet they're still teaching the same curriculum in my medical school that they taught me in 2001.
We have a friend who'd gone into nursing and was disenfranchised a little bit by the rhetoric, basically, of treating the sickness as opposed to helping prevent the sickness.
Exactly.
So when we talk about health, what do you think the number one issue is that's causing all the number one health issue? Like, what is causing what do you think the root of all evil is on diseases and stuff?
Well, I think it's food. I think that's number one. But there's so much that's surrounding that, right? It's how we think about food.
Would you say inflammation then when you say food? Would you say
100%.
Inflammation is the root of all evil, but the inflammation is mostly coming from the lifestyle choices that we choose?
Correct. So inflammation is the number one thing. And there's actually, I think Harvard did a study not too long ago, and they call it infla-aging is the term that they use.
Oh.
And so we're aging because of the inflammation.
Do you mean aging just internally or externally too?
Both.
Really, does it cause wrinkles?
Oh yeah. You think about someone that smokes versus someone that doesn't.
True.
Right?
True.
And that's something that's external, but also things that you eat, right? If you don't have enough collagen, you're going to have more wrinkles. We know that if you put collagen in your diet, you have less wrinkles. And
that's a slow, steady thing because people ask me, I take collagen powder and people say,
by the way, you have very few wrinkles.
I know, right?
Are you 60, 70 years old?
I'm 73.
I knew it.
And also, black don't crack. So, wait, can we say that on here?
Yeah, you can say whatever you want.
You can.
No free is open.
You can say
that. But come on, I need a little bit of that skin. But no, I've been taking collagen, and people say, does it help your skin? Well, it's not something you wake up and you're like, wow, my skin's better. It's something that you have to do day in, day out. And it's the same thing with nutrition. It is nothing that's instant, and we are an instant gratification society for sure.
Yeah, you want to talk about dopamine and how we're an instant gratification?
Oh my gosh! And dopamine has been something I've been researching so much because I find it so intriguing. So, what's your perspective on it?
So, you have essentially 2 neurochemicals, right, that kind of battle one another: dopamine versus serotonin. And of course, we all know about serotonin. When serotonin is not there, we're depressed, right? But what's interesting is that when you keep getting the dopamine hits and raising dopamine, right, it's gonna cause you to have less serotonin receptors. But at some point in time, you're trying to get better and better and better and better, and that dopamine you just can't live that way. Life needs to be kind of boring.
So you're saying that we need to balance it out because if you just keep firing dopamine, then are we going to run out of dopamine?
It starts to your body can't handle it, and then
you don't run out of dopamine, you run out of serotonin.
Well, serotonin decreases, but at some point in time, the dopamine doesn't want to work.
Oh, okay.
But now you're in this like I got to get another hit, whether it's the food you eat, right? That sugar craves. I mean, it's like being addicted to cocaine. It's like, oh, we got to get some more. We got to get some more.
Cocaine, huh?
Yes.
We were just laughing about cocaine before we started. That's why. So that was a funny topic right before. But no, so you're always looking for the next hit. You're looking for that next high. But it's not just through food. It's not just through drugs, not just through alcohol, but it's also through social media.
Instagram. It's like you just keep going.
It's an addiction. It's like your body needs that next excitement. Mm-hmm. So you just think a slow, steady life, you call it boring. I call it, I feel happy in my nice, comfortable, just stay in a comfort, even kill zone. And that doesn't mean boring. You still have fun,
right.
But you're not always looking for that happiness. And I say the same thing about food. If you're always looking for the next meal to be the best thing you've ever put in your mouth, it's probably not the best thing.
Yeah. You'll actually probably gain weight.
Absolutely.
So me specifically, getting that dopamine hit, how do I stop looking at TikTok while I'm peeing? Like I have to. You know what I mean? Like I'm not doing anything else. I got a free hand, right? I only need one hand.
Yeah, so very true.
And so like if phone comes out, I'm checking TikTok, half paying attention to where I'm aiming, it's my dopamine hits.
So that's when you say, okay, how like I'm gonna have a dopamine detox. I'm not gonna look at my phone first thing when I get up. I'm not going to
go ahead.
I'm not going to when I go to take a poop. I'm not going to look at my phone.
What? That's Sean's highlight of his day, I think.
Well, for us guys, it
really is.
I'm guilty.
I think all guys are. I'm like, why does it take an hour to poop? Like, you spent 3 hours in there today, and it drives me up the wall.
I'm making sure.
It's all out. But what? All right, so if we're not going to get the dopamine through, how do we get it?
Well, you get it by eating healthy, balanced meals. You get it by reading a good book. You get it by spending time with family and friends, talking to people. We miss a lot of face-to-face connection. A lot of people only connect over. Yeah.
I've seen a few couples at dinner, like the guy's just waiting for his wife to get off of social media, just waiting, hopefully. Going to have a conversation.
He's making fun of me. Is what he's trying to do, and it's not.
I really want that conversation.
That's what time I post. Is that right at where when we sit down for dinner? It's like,
and you know what? Maybe part of the boring life we really need is less excuses, and more conversation with people we love.
Yeah.
Yes. Yeah.
Depends on the day. The person I love. But what else do you think we could do? So obviously, here, let's go to this. What do you believe in nutrition? What are you vegan? Are you carnivore? Are you any? Are you just about a balanced life?
So I try to do a balanced life, whether you like meat or not, or you do fish, that sort of deal. But once again, balanced. Vegetables, water, nothing processed. Everything should have a mother or come out of the ground, right? Those are the things that you ought to stay with.
So we just did a podcast. Our last podcast was talking about everybody is like identifying I'm either like carnivore or I'm vegan. I said, what happened to the world of just healthy lifestyle?
Yeah.
Of just eating everything in balance and moderation.
Mm-hmm.
You don't have to eat all meat. You don't have to eat all veggies. Eat it all.
Yeah.
And eat it in correct portion size and not overeat.
And that's
a big one.
And that's the biggest thing. Eating correct portion sizes.
Yeah, right now we're hopefully pushing some of the people listening to increase their protein.
Yeah, protein is number one. Protein's key. You got to have plenty of that.
And we have found, and it focused on women, but I mean everybody can get better at eating. But some women were significantly low on protein, like 30 grams as opposed to maybe 130 what they should be at. So that was what we were talking about last time. Would you agree that protein should be that high? Do you think it's more balanced than the way you're talking?
I mean, you can get to a point that you're too high, right?
I try to keep it pound for pound, like ideal body weight, whatever your ideal, not necessarily your weight is now, but your ideal body weight.
Go ahead, disagree with her. Go ahead.
No. I mean that's you have a couple of different formulas, right?
There's a 0.8, but the easiest one's just to round it up.
Yeah, just round it up and go. And so that's a fairly good one. But you think about it, if you don't have enough protein, the body just doesn't work. Carbs and fats are there to fuel your body. Protein's there for the building of your body, right?
Because what you do when you work out, you just break it down. You got to rebuild it. You got to repair.
Ripping fibers, got to repair.
Yeah. Okay. So now that you're doing a bunch of like anti-aging stuff, can we dive into NADs and what you think of those? Yeah. I want to hear. So I have loved them.
Okay. I still don't know what they are.
Can you explain what NADs are?
Nicotinamide, and it's a molecule. There's a cascade within the cell, the mitochondria, which is the powerhouse of the cell. And there's this thing called the Krebs cycle. I'm having flashbacks to biochemistry, and I want to puke a little bit. But at the end of the day, we die when our cell can't produce power to do what it's supposed to do. And so, if we can if that cell can make energy, then we can continue to do what we do. And so, NAD is one of the precursors to that Krebs cycle to make that energy. And so the more NAD you have around, the better your mitochondria is going to be, and now you're going to produce more
giving
energy.
Power to your mitochondria.
Yeah, it's like putting that precursor in there so it now works well.
So, okay, so you would suggest taking NADs if you can.
Yes.
But oftentimes, and please correct me, when you start taking things, you start producing them yourself less. Is this the same with NADs?
Sometimes, right? With certain hormones, like if you're taking testosterone, well, now we're going to produce less. It's not necessarily that way with NAD. NAD can help us. We give that precursor to now that's not going to be there anyway. You could get it from food or you could get it from somewhere else. But instead of doing that, you just
because your body's not producing it. It's not like that.
Your body's not.
Okay. Well, yeah, that's okay. I didn't know that. Okay.
Yeah.
And so, basically, NAD is cellular health.
Yeah, exactly. Cellular health.
So, do you think it's best for people if they want to do NADs to go in and get the bag? So I've seen. Okay.
The bag.
Yeah, the IVs.
Not that bad.
But the IVs, like the ones, the people that have done the IVs tell me they've gotten sick from them when they do them because they pump them full of like 750. Is it milligrams or I forget what it's even measured in?
Yes, milligrams. And the reason they probably have gotten sick, sometimes when you give that too fast, and NAD should be given over hours.
They usually take like 2 hours, 2 to 2.5.
Yeah, at minimum.
Yeah. Oh, at minimum.
2 to 4. And so normally those symptoms come. Some people will get. I'll tell you, the first time I took it, I was in between patients, and I was just slamming in there, and I thought I was going to die.
Did you do the IV?
Oh my God.
I did IV. Yeah,
no,
like heart racing, like headache.
That's what I've heard about, the heart racing, the stomach, everything.
I was like, this is a mistake. This is it. Can someone call my
energy
family?
overload?
Like it's over.
Is it? I mean, is it generally actually like the feeling of taking an energy drink?
No,
it's. I mean, that heart just.
Well, that was
going,
taking it. Okay,
taking it too much.
Did you do the 750 milligram?
I can't remember exactly what I did. It may have been 750. It could have been 500.
Yeah, those are the two that I know.
We did it like over 30 minutes.
Oh,
so you would suggest not doing that?
Definitely don't
so
do it.
I went the different route, and I do injections.
Injection, I think,
and I do them twice a week.
Mm-hmm.
I have the option of once or twice a week. And when I do the injection, within like 5 minutes of it, it's like my whole body goes kind of limp. And it's kind of like a really weird, relaxing sensation, almost like my whole body goes limp. And I just sit down. And then the first time I did, I was like, oh my God, am I going to pass out? Like, what is this? And then like 30 minutes later, feel fantastic. Yeah. Not even that long. It's probably like 10 minutes actually. I feel great. And my energy is really high. But I'm not doing the mega dose like that. Is that why I don't get the same, like I don't get any sick effect. My heart doesn't race. I don't get any of that. My experience with NADs has been amazing. But because I'm on a smaller dose, does that mean I'm not going to get as good of results? Or
no, you'll get your results will be just as good. It's just that when you give it IV, it gets there super quick. When you give it IM, it takes a little bit longer. It's a little slower.
And IM is an injection?
Intramuscular or subcutaneous, that sort of thing.
And so what are the results you're hoping for? Okay, you're talking about cellular health. You're talking about the longevity of your cells. You're talking about youthfulness as far as like your cellular level. Yeah. But what are you truly hoping to get out of it? Like, do you see it short-term, long-term?
You can see it short-term. You can see it long-term. When the cell can do what it's supposed to do, right? Now it gets rid of things that aren't supposed to be there,
like cancer cells.
So it goes, okay, hey, you're not supposed to be. You're not supposed to be here. Let's get rid of you, and it takes care of that.
But it's not something that people just take for cancer and get rid of it.
It's not that they do it for that, but it can help with
a preventative because we all have
like early catching.
Well,
of
the
cancer.
thing is, we all have bad cells in our body.
I was about to say, like, there's cancerous-ish cells.
We all have the bad cells, and you either are going to feed them with what you eat, or you can fight them with things like this, or just being healthy in general, like deep breathing. Have you heard that deep breathing is supposed to help with cancer cells and things like that because it can't survive under oxygen, right?
Well, that probably plays a little bit into it, but deep breathing, when you reset that nervous system, and this subject is really big to me as far as what I'm studying and learning.
I'm obsessed right now too, so I get it.
Yeah, so when you have that sympathetic nervous system that continues to fire and fire and fire, like our bodies, when we're continually on edge, our bodies doesn't do well. That's when disease comes. That's when we have issues and problems. And
the walls are down.
Is that because cortisol is high? Is it because cortisol? Is it
which is now going to
fight or flight kind of mode?
Which is now going to make your immune system go, I just can't work. Like I just can't do
Really?
it. So that's when cancer cells come about. That's when we gain weight.
Or even simple as catching the cold, where some people don't get it all season and some get 4.
Because now our immune system doesn't want to do what it's supposed to. So now it doesn't do what it's supposed to. There's no energy for it to do what it's supposed to. So now cancer cells just kind of roam and do their thing, right?
Man, I don't take NADs. I must just be built different.
Because you don't get sick either. But
and some people, they're made that way, right?
I
would like to take it eventually.
I think that you need to start. I think I would love for you to start, but I feel like in general, both of us don't really get sick much, but that doesn't mean that the NADs can't benefit us.
Right.
Because do you believe it helps in like outward appearance too in any way?
Yeah, right. So if it's just like if you think about us when we were teenagers, right? It's when we had the best skin. Well, I mean, not when we were 13 or 14, but it's like, oh, everything's super youthful.
Like 20.
And that's because the cell works properly.
So you honestly believe that you do obviously it's not, you do it one time and it works. It's going to be over a period of time.
Period of time.
How long have you been taking it?
Gosh, the first time I took NAD was 2018.
Oh, so you've been doing it for a while. Yeah. Do you do it regularly?
I don't do it as regularly as I used to, but I kind of, once you've kind of done it for a while and you're just kind of, okay, I'm going to do a little bit here, I'm going to do a little bit here.
So when you do it now, do you just do the IV or are you giving the injection?
I've done all of it. I've done injections, I've done IV, and I've also taken like
the oral?
Oral too. Not as effective, but is easy to do, right?
And the oral one is it true that the oral can be taken daily?
Yes. Yep.
The oral's daily and the injections, well, I guess you could do different, depending on your dosage, right? On the injections, you could either do it
once or twice a month or once a week. And then like as far as IV, or you can do injections once or twice a week.
But on the IVs, is there like a loading phase, right? I've seen people say that you got to do it like 3 days and then you just follow it up after that.
You can. I think that's, overkill.
Is it a little overkill?
And life gets busy, right? Like we're going to go for
2.5 hours for that long? Yeah. Each day?
And so you eventually catch up with it.
Do you feel like that is people just trying to make money off you if they say that that's what you have to do?
It could be. There's always a little bit of those things, right?
Might be.
Yeah, so I mean, I study and
that's a good idea. It's a good question, though. Like, what are the costs involved in it?
IV stuff, so taking it orally might cost you $30 to $60 a month doing it orally.
30 to 60. Insurance doesn't cover it.
Doesn't cover it.
$30 to $60 a month is a lot lower than I thought.
Yeah.
Because it's still effective, not as effective as different ways.
But you can imagine if you're doing it over time, right? You'll eventually get there. But definitely
like multivitamins. I mean, are they horse pills?
They're not crazy big. But you can imagine doing an IV or doing an IM. It's going to get in your system quicker, faster. Yeah. Right. And usually people are probably charging anywhere from $150 to $600. It just kind of depends on where you go.
150 to 600. Is that for the injection?
That's for IV. Injection is going to probably be more around that, 100 to 100.
Is that per injection or you think per month?
It would probably be probably about a month's worth.
But you say your belief is that NADs are actually worth the cost.
Oh, for sure.
Worth the cost. I mean, I have actually.
I like the different price points.
I've actually fallen in love with it. I was like a little leery. Do I want to take it? Is it worth it? Because I've actually heard the rumors of it could cause cancer, but I think that's all been debunked. Like everything I've been studying now is it doesn't cause, like if you have tumors, it could make the tumors grow more. But I heard that that's actually not true. Do you know?
Yeah. When you have cancer, all bets are off with certain things, right? Because it can feed that, and that can be more powerful. But if you are for us healthy individuals, it's going to help us in the long run, right? Because now our cells are once again stronger. They do what they're supposed to, and they're going to have more surveillance on those cancer cells and get rid of them. So it's a very good thing.
Can this help prevent the fact that I might get Alzheimer's? Now get the brass tacks, because ever since my grandpa had Alzheimer's, it scared me to death.
Yeah.
I've heard a lot of Alzheimer's is coming from cholesterol lately. The cholesteral medicine.
I know it's a question out of left field, but I'm just like, if that's one thing that prevents it, give me
it's been
7
super
doses.
interesting to study about this.
Yeah, so if you think about cholesterol medication, this is why I'm not a big fan of cholesterol medication.
I don't think I would ever go on after what I've been learning.
Your brain is made up of cholesterol. Cholesterol is the mother of all hormones. Why in the world would you want to have a medication that decreases that? And by the way, it doesn't even really prevent heart attacks and strokes and all that stuff.
No, because they said after we've started giving all these people cholesterol medicines, we've had the highest rate of all the other things because of it.
Yeah.
So you would agree with that?
Yeah. So
because I don't know where they said comes from. Whenever you tell me,
so
stuff.
I can't tell you. I study it, but I can't give you quote who it came from.
So in the literature, right, and it talks about these things. But if you think about it, you go, okay, we're going to take this cholesterol-lowering medication. My brain is made up of cholesterol. That seems like it's going to make me a little dull. And it would. Because now I don't have the cholesterol that I need for things to function well. Hormonally, brain-wise, that's a no-go on my list.
Yeah, it is for me too. Man, I feel like we could sit here and chat forever about all these.
Yeah.
So let's wrap it up. What would you say your number one thing is to make yourself just be be healthy and prevent instead of try to fight every disease?
Yeah. Diet. It's the things that everybody knows. Diet.
But we don't want to hear it.
Exercise, sleep.
That's where I really struggle. I don't get enough sleep, for sure.
Learning to cope. We could do it. And I don't mean coping. Like, I don't like the word coping skills.
Wait,
like raw dog. You mean like raw dog life?
Well, like you
got to raw dog that life.
Yes, raw dog in the way of I'm accepting life where it is.
It's not perfect.
Not perfect. The obstacles are the way, and it's like, okay, it is what it is, and we're going to roll through it. Versus coping with food or all the other things, right?
Turning to something that's
so. In other words, life isn't perfect. Deal with it, and let's figure out ways to just be a healthy person and not turn to drugs, alcohol, food for our
toxic
relationships, all those things.
Yeah, basically to mask everything.
Because I would assume there are instances where some sort of medication might be appropriate.
Could be. Yeah, there are times when they are needed and can be used appropriately, but there's not, to be on things for life, right? I don't know if we.
Yeah, I don't know.
You've talked about that a lot, and we're jumping around here, but one of the things you've always been proud of is that your parents had made you kind of deal with what we all assume is ADHD.
Well, I was diagnosed really young with ADHD in kindergarten. Actually, I was in special ed, all ADHD
Back
and ADD.
In 55?
Be nice. Back in the 70s. No, actually, it was the 80s, early 80s. But I was in special ed for all my childhood because my parents wouldn't put me on Ritalin, which I am so thankful for, because had I been on Ritalin, I would have never been able to go in the Marine Corps.
She'd been raw dogging it since 77.
So I was taught, I had to be taught how to deal with it as opposed to mask it.
Yeah.
And I'm pretty certain Hayden has it too, which is my son. You know Hayden. And we went through different learning things because I chose not to put him on meds either. Right. But do you believe that there are ways around a lot? Well, they're saying now ADD and ADHD, a lot of it's nutrition.
Yeah. So when you talk about methylation, it's 100% that.
It's crazy.
And so now you've got this disease that could be helped or even prevented with certain supplements.
Crazy.
B vitamins, folate.
Oh shoot!
All those things.
All of it. Man, we could talk forever. But we're gonna have to have you back on, and I want to dive into next time. I want to dive into stem cells, PRP, and then we can have
stem
another
cells,
topic.
PRP. But listen, Dr. Kellum's going to be back. I want you back. I like hearing from you. But leave your comments about. Basically, Nashville Regenerative Orthopedics. That's your company.
We changed the name about 6 months ago. It's now Kellum Stem Cell Institute.
Let's go.
Oh, I like
Stem
that.
Cell Institute. I like it.
That.
But Ask away the topics you might want us to talk about, to clarify, to get some expertise on about staying young inside and out, right? The things you might want to stay away from, questions about things that you might have heard from doctors or friends that you might be able to give some clarification. I think that would be amazing. So
but I hope that you guys have learned something. You've been able to take something out of this. You guys have asked tons of questions about NAD, so I hope that he explained them to you. It is a topic that a lot of people aren't quite comprehending, but I think that we can just keep talking about it because I think there's so much you could talk about with that.
There's so much.
But hey, you guys have been awesome, and thanks for coming on, buddy.
Thanks for having me.
And we'll have you back.
Sean, thank you.
All right.